Drishti's Wednesday webinar series. And this is our 58th webinar. And today our topic is generally about how culture and societal attitudes affect our perspectives as well as our management of mental health. And today we have two very distinguished guests with us. One is Dr. Dipti Gada. Dipti has been our guest on previous many webinars. And Dipti, thank you for joining us today. I just thought it would be very interesting to get both a psychologist and a psychiatrist perspective on otherwise, the discussions about culture and society and its impact, it seems to be very humanities based, right? But in reality, you see it to be different because even as medical personnel, you're constantly dealing with this, right? So I just thought it'd be good to have, both the sides looking at it. And our other distinguished guest is my colleague at the Bombay Psychological Association, and that is Dr. Wilbur Gonsalves. Wilbur is Associate Professor of Psychology at the Department of Applied Psychology, Mumbai University, and he also is a practicing counselor. And therefore, I thought we really have a good mix because Wilbur is, an academician as well as engages in practice, and therefore he can come to us again with very different perspectives. So before I really kind of roll out the webinar for today, first and foremost, a very very big thank you to both of you for giving your time to be here on our webinar, and of course a very very warm welcome to all the participants again, right? Just to let you know a little bit that our these Wednesday webinar series, we began just when the lockdown began, right? So it's been more than a year now. I mean, a year and a half. We're going to come to almost 2 years, and we've very successfully done. I mean, in a short while, we will be completing 60 webinars. So and we've tried to kind of reach out to different audiences. We've tried to get in different panelists, so from very socially diverse topics, right? And of course they've all revolved around mental health and education. Now all of this is actually an initiative of our it's actually an offering from our other initiative, which is known as Prabhav. So Prabhav is our other online platform through which we are offering a lot of different digital endeavors. So we are offering courses, we are offering certificate courses, just very short, what we call toolkits. So, this is all an initiative towards psychoeducation. Okay. And this reaches out to students of psychology and education, parents, therapists who are otherwise paraprofessionals, teachers, school leaders. We've got a little bit of offering on all of that. And of course, now we're also putting up quite a few of our courses on Udemy. So, of course, if you just visit our website, which is prabhav.education, you will also be redirected to our course on Udemy. So, just want to kind of talk about this because, all of these, all our digital endeavors is towards awareness about mental health. Okay, whether it is the disabilities, whether it is you and me out there, I think all of us have a story and all of us need help at some time or the other, right? So with that, let me start off today's session. So what really comes to mind when you think about culture, right? I don't know about you, but for me, and I think for a lot of us, we immediately think of what's in front of us, like unique languages, different clothes that we wear, different rituals and customs, the way we celebrate festivals, the diversity in our cuisine, and all of that. But a society's culture also impacts a person's beliefs, norms, and values. It impacts how you view certain behaviors, ideas, and your normal routines, right? And in the case of mental health, it definitely impacts whether or not you seek help, what type of help you seek, um, how much the community is going to support you, which of your family members are going to participate in this process of mental health management, right? So, because culture refers to a shared set of beliefs, norms, and values, it impacts not just an individual or a family, but it involves the entire society, right? And that has been, the societal culture has been quite an obstacle. That's where stigmas about mental health emerge from, right? And the more psychoeducation we can engage in, I think, the better, the more aware we will be, and I think more steps that we will take. So, maybe my first question could go to you, Wilbur, and that is that, what do you think is the importance that society at large should understand the role that culture plays in mental health management? Just your thoughts on this since we just opened the
Okay. So first of all, thank you, Dr. Smita, for having me here.
pleasure.
Yeah, and it's a very important topic. And I remember some years back we had introduced this course on multiculturalism, one of its kind elective course in our syllabus at Mumbai University. Because we found that the discussion or the discourse of culture, okay, and cultural diversity within the context of psychology and mental health needs to be embraced. And I'm really happy that Drishti, through your efforts, is taking up this webinar today, because I think that's one thing which is very less discussed in psychology circles. We
Absolutely.
are more about symptoms, about characteristics, traits, and personality and intelligence, but we do not want to discuss culture. So I feel it's a good initiative that we are discussing this today. Now, coming to your first question, you very well summarized the meaning of culture. So, to the meaning of culture, I feel what culture is and how culture is relevant to us as psychologists, psychiatrists, anyone who is working in the mental health domain, is understanding the meaning making process. Culture is the, you can say, the agency through which we engage with a meaning making process. Okay, now this meaning making process is phenomenological in nature because it's subjective. We bring in our perspectives, but our
Yes.
perspectives are not free from how we are culturally conditioned. Okay, as you
Right.
rightly said, they are shared beliefs, belief system, values, norms, okay, ideas about taboos, okay,
Yes.
ideas about what are the shared customs, ideas about honor and insults, so all this, okay, what should be considered right, what should be considered wrong, what should be considered appropriate, what should be considered inappropriate, all this, how we will be accepted by society, what will lead us to rejection from society. I think these meanings are somewhere, embedded within our psyche or our self through the process of cultural conditioning. And this process of cultural conditioning starts from the family. If you look at our earlier psychodynamic theories, okay, there was a lot of emphasis on family and family interactions, family influences, and however the family, what is the family, okay, and what are family interactions? Family is nothing but the vehicle of culture, right? It's the primary vehicle of culture. Okay, family
Absolutely.
is the one who transmits the cultural knowledge in a young child. Okay, embeds cultural meaning, symbols, ideas within a young child. Okay, within his psyche, within the growing self. Okay, so the notion of how he sees himself and how he sees himself in relationship with others around him, okay, in the terms of social class, in terms of social inequalities, okay, in terms of fairness, unfairness, justice, injustice, stereotypes, being on the receiving end of certain stereotypes. All this is a part of the meaning making process with the self indulgence, and hence it becomes very central to the discussion of mental health, I feel. There's a lot of literature, but when you engage in discourse, I think that is something which is very important. Because literature is there in books, but unless you do not bring it in, a central discourse,
Yes.
how we are doing right now, okay, it
Yes.
is untouched. Yeah, so this
Right.
is just my starting points. which I would like to add.
Wonderful. Yeah, great. And I think I'm going to go away with that little phrase of yours, where you said that family is the vehicle of culture, right? And I think you know, family, that first unit of interaction, plays such a large role in all the perspectives we have, including, the cognizance of mental health, of what importance it plays in our lives, etc., etc. So, Dr. Dipti, coming over to you, yeah. Um, what are your thoughts on how do cultural attitudes impact the understanding of the symptoms of mental health, or mental illness or mental disorder? You know, what's the impact of cultural attitudes on understanding the symptoms?
Um, I think culture, as Dr. Gonsalves and you yourself have also said, that culture plays a very very important role in forming the basic belief system of an individual and the family and the community. So symptoms of mental health, unfortunately, are not very clear cut. They are never like, you got fever, your temperature is so much, then you take crocin, or you go you're tested for malaria. So they are not very clear cut. Hence, most of the symptoms of mental health are very very colored by the culture, the tradition of the community that you are living in. Like most common examples that I can give you is, most neurotic symptoms in our society will be considered as, nazar lag gaya kisi ka. So the
Right.
moment you find that, somebody is dull, somebody is low, not talking much, oh, the mother will go to that child and, put some salt around and, do some kind of thing, nazar utarna, nimbu phekna, something like that. So these
Right.
are the common ways in which, the symptoms are considered, though they may be symptoms of a mental health, maybe an anxiety, maybe a slight depressive symptom. It is usually
Right.
considered kisi ka nazar lag gaya. Yeah, if there are more psychotic symptoms where, the person has become very violent, very aggressive, then they will say shaitan ne pakad liya, devi aa gayi. So those are the ways, that the symptoms will present. That is how it will be understood by the people
Understood.
around
Yeah. Yeah.
the person and the person himself or herself. So this is the way, and also typically I have seen, that even when patients come, after several referrals, mean to many physicians for some physical symptoms, you will find that, we have a lot of people who will come with somatization of their symptoms. They will
Right.
convert their psychological symptoms into physical symptoms. And typically, there is actually even research on this, but a typical observation that I have is that people from the northern part of the country will generally come with abdominal symptoms. Meetha meetha dard ho
Okay.
raha hai, gas, belching. These are the symptoms of anxiety that you will see in people from the northern part of the country. People from the
Okay.
western part of the country will come with headaches, especially
Okay.
from Mumbai, Maharashtra. They will come with headaches as somatic symptoms. So, even
Uh-huh.
that kind of a cultural diversity in terms of symptoms we see, general observation. I've been working for
Very
10 years in
interesting.
the field.
Interesting.
So, the symptoms do come so very differently, and then you have to really tease out, talk to them, and, go. This is very superficial. So, you remove layer by layer and try and get into the depth, and that's where you actually get the core symptoms of the illness, and then you are able to diagnose. But at the superficial level, it is very very culturally colored, and if as a clinician you're not aware of the culture, it becomes very difficult for you to diagnose and reach the right line of treatment.
Yeah, in fact, I'm coming into that, that interplay that's going to be done. But, Dipti, I found it very interesting what you just said, when, I mean, and we're all aware about it, that, it will be spoken about as, the Devi, which I used to see in my extended family happening when I was a child, and about the shaitan. And if you think about it, the way it's being understood is, if you go to see, they're externalizing the causation, right?
Absolutely.
Right? They're not saying something's happening to the person. They're saying something outside is responsible for this. So, I mean, that's some food for thought, thinking about. I've never thought about it, but I was just reflecting on when you were saying this, that all these things that in our culture we speak about really mention so much about externalization. Excuse me. Um, so coming to you, Wilbur, I was reading something about these culture bound syndromes. Is this
Yeah.
something that you could throw some light on?
Culture bound syndromes are basically, a lot of work has been done in Southeastern research, okay, and Southeastern research, Latin American research, because these are cultures which have been largely ignored due to the Oriental approach towards understanding disciplines. Where a lot of American European type of hegemony has been there in conceptualizing certain things. So a lot of research has been done today on certain set of symptoms which co-occur in local cultures. Right. For example, in India, you have not in India, but in northeastern states and places like Malaysia, you have something like a called it's called the Koro syndrome. Okay, so the Koro syndrome is basically feelings of that anxiety that your penis is shrinking and it's entering your abdomen. So such type of this. Okay, something similar is found also in South India. Okay, which is called Suddu. Okay, now Suddu is looked at as some type of pelvic heat or heat generated through urination. Okay, somewhere what I feel common in most of the culture bound syndrome what I've read about is there is a commonality of some form of sexual repression. Because I feel in Eastern cultures, okay, sexuality has always been a taboo topic, and there's a lot of issues of honor related to your sexual organs. There have been a lot of suppression about even speaking about or acknowledging your sexuality. And I feel a lot of this manifestation, okay, of such type of syndromes, okay, even in the Dutch syndrome, okay, which is found in northern India, okay, these aspects of sexual impotence is very common. Okay, so I feel there is one commonality is about this type of this sexual symptoms, okay, or a sense of sexual importance or anxieties about sexual importance. Also, there is an underlying factor of anxiety, okay, because we come from such underpowered, sometimes unstable, insecure environments. Okay, that anxiety becomes something very natural in us, and I think that also explains this sense of externalization. Okay. Apart from externalization, also I feel what Dr. Dipti was speaking about somatization of symptoms. Okay. Somatization is mainly understood also as something what a human being does not have control upon. So there is one tendency of externalization. Secondly, okay, that you require medicines to deal with that, and Dr. Dipti is a medical professional. She would able to throw more light about it. But the idea of that when you have bodily symptoms, vis-a-vis acknowledging psychological symptoms, okay, you are saying that you are experiencing something what you do not have control upon. So this tendency also is, I think, somewhere explaining, okay, this whole idea of either externalization or showing a lack of control over one's condition, which is experienced by people.
Also, like you said, Wilbur, that that somatization.
Yeah,
Dipti, also don't you feel that it's something that is also more socially acceptable, right? Like you
yeah,
have a physiological issue, that's fine. We can deal with it, right? But if you have a emotional issue, then you're responsible for it.
right.
No one else can do something. So it was. I think I want to take off from that somatization because that's something interesting. And Dr. Dipti did say about how the different ways in which mental health issues can be presented, and of course she spoke about how those can also be so culture bound, right? Um, Wilbur, in your counseling practice, what
Yeah,
might be the different ways that different cultures might be presenting? Because today in our country, are different regional areas are different cultures. Within Mumbai, it is so multicultural. So, any that you can throw light on, and perhaps even Dipti, you can perhaps throw light on this because I think that's quite enlightening for the people who are with us today, and it's also something which these are like coming from, experienced people like you, which one can just keep track of when one is actually in the role of a clinician, right? So Wilbur, if we can start off with you, like, what might be some of these cultural markers that you usually see?
First of all, as a practicing counselor, I believe, and even in our training, okay, we do emphasize that first of all, acknowledge that you are a cultural being. The part of being a cultural being yourself, as a therapist or as a counselor, uh, is that you yourself can have your own cultural biases. Secondly, you are prone to ethnocentrism. Now, what I mean by ethnocentrism is that we are more likely to judge others by the way we are cultured, or the way we are, through our values, our customs, our perspectives, we tend to judge, interpret, okay, or make meaning of what others are telling us or what others are saying. Uh, the moment we start acknowledging and accepting us that we are not perfect, and we are more very likely to have our own biases, okay, own perceptual biases, own interpretive biases. That's the first step, I think, how we can deal with, acknowledge the idea of culture within our practice. Okay. Second, I feel what is important is, uh, because a lot is emphasized on experience, okay, and a lot of content, okay, or narratives, what clients get to sessions. I think symptoms is one aspect, but the narrative around the symptom, okay, is what needs to be focused upon. When you look at the narratives, okay, you find a lot of culture-rich content which comes out, okay, and then it becomes very easy to connect the dots, or to think of how, for example, anxiety is as a result of, probably the feeling of letting someone down, okay, or the fear that you let someone down. For example, a woman who is working, okay, and who is gender sensitized to, gender sensitized, her gender schemas predispose her to think that it's a first duty to look after the family, and it's a secondary duty to look after, her career goals and think about her career goals. So the idea that she would always be under that thing, that if she does not fulfill her family obligations, okay, she'll be letting others down, she'll be letting herself down, she'll be looked down upon. Okay. So she'll always be, predisposed to this type of feeling of anxiety, the type of pressure or cultural stress she would be undergoing. These narratives are very important in interpreting, or understanding meaning embedded within, what we interpret as symptoms, what we interpret as, characteristics, or what people manifest in their behaviors. So I think this brings a cultural context. Third point which I would like to emphasize is, so we look at experiences. So judging experiences is one thing. Thirdly, we need to understand from where do people come, what is their background, okay? Because from where, what they are, but from where did they come? What was their uh, growth process? Okay, what were the type of socialization processes they went through? What were their type of developmental experiences they went through from their cultural thing? What is their type of background? How conservative, how liberal their background is? Okay, how much experience of, we call it power distance, or I would to simply say that, where in the type of cultural hierarchy do they place them? Okay, so experiences of humiliation, experiences of deprivation have been there, for people who probably came from low socioeconomic, backgrounds. So from where do people come is very essential to understand, because we cannot look at them as individuals in the here and now sitting in front of us, but from where do they come, okay, also determines, okay, how they have, become who they are. So I think these three things, if we take care and we are able to align our interpretations with their narratives and to understand the background they come from, if we are able to align this, then the meaning making process, then the helping process in counseling or in therapy becomes more meaningful for the client.
Yeah, I completely agree with you, and I think it's brilliant thinking about this narratives, because I know in my experience, like, very often when we kind of hit we hit a block in therapy, then we say, oh, but that's the culture the person is coming from, so the person is not responding, or that's how the family is, and therefore that's a block to progress. So those are the things. But how about, I think, if we initially, when we start the counseling process, if we delve deep and explore into the cultural aspects, we will even understand, I think, how we should proceed. Um, Very often, I think we just don't factor that in, right?
Absolutely.
We're not factoring it in. We start factoring it in when we start hitting some roadblocks. I mean, just through personal experience. So I think
Right.
that's great, Wilbur. Dipti, any thoughts on this before I actually shoot a question to you?
I think I completely agree with what you and Dr. Gonsalves said. I generally try to, use a few techniques in order to understand the cultural background of the person.
Okay.
Me practicing in Mumbai, I try to talk all languages which my patients are likely to talk. So when I talk to
Okay.
them in their
Right.
mother tongue, they tend to open up better. They tend to kind of be more open to us, tell us what
Absolutely.
is there at the
Absolutely.
back of their minds. I also usually try and understand the cultural practices, so we use those words, कि
Yes.
अभी जैसे रमजान है तो आप सहरी करोगे, so I use those
Right.
words and they
Yeah.
feel that I know their culture. Okay,
Yes.
so that's where
Yes.
the rapport gets very easily established when they feel that I understand the culture, so they are able to narrate a lot of things which otherwise they would not narrate to a doctor, because otherwise they would
Correct.
feel, how does it matter to the doctor? So
Yeah. I've come
when
for
you
some
ask
medication, right?
questions, unless they feel that they are connecting with you, they will not narrate to you. So
Correct.
that's why it's very important for us to pick up these practices. So learn from every patient or every client of yours. If you really keep your eyes and ears open, you will pick up these words. You will pick up these practices from your clients itself, and then you can use it in your subsequent clients. So that's how I like to factor in the cultural perspectives, especially
Right.
if you have like a very conservative family and there are interpersonal issues between the daughter-in-law and the father-in-law, that the power setup is such that
Yeah.
there's not much that you can work as an interpersonal therapy, so you have to work at other ways,
Hmm.
to
Hmm.
help the anxiety or to help the frustration of the client. So those are the areas where if you understand the cultural perspective, the family dynamics, then that helps you a lot, where probably you'll not get so many blocks in therapy as you were talking about.
Right. Right.
So
Right.
we always try and make a family tree. We always try and make understand the dynamics of the family much before we actually plan the therapy protocol and plan the therapy per se. So I think that definitely helps a lot.
Right, right. So, coming to that, I think what you were getting onto is, like, how does the culture of the patient or client, culture of the clinician, and also of the service system, whether it's a hospital or a school or a therapy center. So, how do these three pieces, so to say, of this equation or of this jigsaw really factor into, what we can give in mental health care? Just a few thoughts on that, and Wilbur, maybe then, we can move on to you and have your thoughts on it. Yeah, Dipti.
Yeah, so obviously, all the three factors are going to be extremely important. The
Right.
cultural perspectives of all three. So we've talked a lot about the cultural perspective of the patient. I think
Yes.
Dr. Wilbur has highlighted our own cultural perspectives and biases as a therapist. So we are aware of that.
Hmm.
I think the therapy center or the hospital is another area where that plays a major role. Um,
Right.
Initially we had these institutes and there was a lot of institutional practice. We got into deinstitutionalization, where
Correct.
we brought the therapy more closer to the community,
Community.
treatment
Yes.
more closer to the community, which is a very, very good option that has now been, I mean, the policy which has been taken care of. So I think that helps. I think having a mental health setup in the general health setup helps a lot, because then the stigma is lesser. You are not going to a special, a facility which is specially for mental health issues, because we whatever said and done, there's huge stigma. We just have to accept it, and we have to work around that stigma rather than confront it all the time and tell the patients to get away with it. So I have clients who will come in, who will tell me, you give me an appointment when there are going to be no other patients waiting in your waiting room. I don't want people to see me in your clinic. Or you do an online session for me, because if I come to my clinic in your building, I have two friends' offices, so they will see me and I don't want to answer where I'm going. So, a lot of these kinds. So where your setup is, what is the kind of ambience that you have in your setup, uh, especially how your support staff is talking to the patients, how welcome they feel in your center. I think all these are very important. We need to make things as patient friendly as possible, because we know that they're actually battling, of course, their own illness, but at the same time the huge stigma and reaching the therapist. As we know the statistics, it's only about, even in the urban setting, it's only 30% patients who reach the doctors or the therapists at the most, amongst the people who are actually suffering. So when they have battled so much and reached your center or reached you, I think it's very very important that you make them feel comfortable, you make them feel welcome, so that they are going to, then they are the best ambassadors that we have. If you have helped someone and that person has gone into the community and spoken about his or her experience, I think they are the best ambassadors for awareness of mental health. So that's what I think we need to do. Sometimes we as doctors especially, sometimes we feel मैंने बोला तो करना है तुमको. We have
Right.
that authoritarian
Yeah,
kind
yeah.
of thing, that I'm telling you this is right for you, so
Right.
we need to shift from there, and we need to work. So the kind of perspective, cultural perspective that the treatment center comes with, I think is extremely important, and that needs to be modified, that needs to be worked at. Many a times they say that we are going to continue to going to the faith healers. We say, okay, ab dawa bhi karo, dua bhi karo,
Right.
rather than try and convince them ki nahi, nahi, this is only a medical problem, this is not a bahar ka shaitan, or this is not
Right.
something.
Right.
So we don't kind of we incorporate both together, go with the flow of their cultural
Correct.
perspective, keep them in treatment, and make sure that we're doing the best for them.
Right. I think the nugget that I take away from what you just spoke is about the fact that how it's going to be so important to keep mental health care as a part of the general care. And I remember attending a kind of a small conference where there was a lot of where there was a lot of like people to people discussion. And I remember, Dr. Yusuf Machiswala, Dr. Kersi Chawla, Dr. Avinash D'Souza. And I remember this conversation with them where, what they said is what we need to look forward to is if we can have a psychologist with every general practitioner or family doctor, you know that's when we're going to get away with the stigma, because people go to their general practitioner at the drop of a hat, right? I mean, I'm talking pre-COVID and whatever, right? You just go, I've got a bad cold, I go to the doctor, right? And I know that a lot of GPs are so perceptive that they are in fact able to gauge very well, and because they know the families very well, they're able to gauge whether this is actually a social emotional issue, you know and what if we had a psychologist who was just there, right next door, and the GP said, well, you could meet someone to talk to, right? I mean, imagine, it would get your mental health care almost to the grassroots, right?
Yes. So I
So
think
that
the
was a
government.
very nice conversation, which I just remembered, after when you spoke about this.
Right, right. So I think we are working, the government is also working, trying to train the community health workers
Right.
towards understanding of mental health issues. So with the new mental health policy, things are improving. We are
Right.
trying to work at the grassroots levels, at the PHC level, the primary health center level, because
Right.
urban areas is still very easy, but rural areas, it is a very, very tough task. And luckily, we have now a lot of things in place, the district mental health program, the state mental health program. So I think at the policy level, changes are coming in the right direction. And we are
Right.
very hopeful that, that will help in the long run.
And like anything, we only wish it would be speedier, right?
That's true.
Okay. So, Wilbur, before I get on to you, I would encourage all the participants on this webinar to please put in any questions, rather than comments. But I would request you to put in questions into the chat box, which I can then direct to our panelists. If you have anything for a particular panelist, you can just put down their name and I will just direct it out to them. If not, and you have a question, just put it down there and I will redirect, right? So I would encourage you to do that. And while you do that, I have a question for Wilbur. Wilbur, Dipti just spoke a lot about community, right? Community support. Um, how do you think, yeah, in your experience, and of course as an academician also, how do you think culture impacts the way the community supports mental health management? What
Uh,
happens in reality?
Uh, First thing I think what culture does is determines the attitude towards mental health.
Okay.
And earlier Dr. Dipti also was sharing of for example how there was more idea of you know attributing to some supernatural cause, saying that uh, Devi aa gayi, or some other reasons. Okay, so what type of attribution they make to this idea of mental health? Okay, so what are their attitudes? How do they view mental health is very important, and this can be dealt with psychoeducation. Okay, uh, so the first step is, so I agree with Dr. Dipti that you need to reach out, and what you also said, that probably every medical professional, every local, healthcare facility needs to have a psychologist, a counselor, a mental health professional, okay, some type of first, community worker who probably is trained in some first aid type of counseling being there. But however, at the same time, having a facility and getting people to avail of a facility is the gap which also needs to be dealt with, and that
Right.
challenge becomes is the readiness to accept, okay, mental health issues as as well as general health issues. Okay, like because for many people who come from especially socially disadvantaged background, thinking about mental health is a luxury. For them distress is a part of day-to-day life. Okay, and it's a part of common experience what they experience. So for them to think about distress as distressful, is something which they do not pay a lot of heed to. Okay, and for example, even the idea of privacy, okay, is so much culturally embedded. Okay, we are told in our households that I remember as a child told कि घर की बातें बाहर नहीं बताते. you know
Yeah.
the idea of secrecy, the idea of privacy, or if you speak about your family or shortcoming in the family, it will bring shame to the family. Okay, घर घर की परिवार वालों की बातें, like so if you have an abusive father, or you have a father who is drinks most of the time, even speaking about that, okay, because that's a requirement in therapy, right, is a matter of overcoming this idea of privacy or secrecy within a family. So their readiness to engage in such a process is something what needs to be also addressed. Okay, that this is what I normally do, because I'm not a part of institutional practice as such,
Correct.
because I'm into private practice, and clients contact me, and I engage with them. I normally before entering into therapy with them, I do have a pre-therapy telephonic session with them, explaining to them what therapy is, okay, what it entails, what would be required of them, because their readiness for this is very, very important. Most of the times I've seen that, for example, because of our gender socialization also, most males do not turn up for counseling. They book
Absolutely.
appointment, they
Yeah,
because
yeah.
for them the gender socialization makes them feel that speaking that they have issues, okay, is portrayal of their weakness, and hence they do not want to acknowledge it, come in the open about it, to acknowledge that they have an emotional aspect to their self. Okay, that they can be disturbed, they can be troubled, they can cry. Okay, this type of acknowledgement is, they do not want to acknowledge it, especially in front of someone else, okay, who they probably consider as a stranger, and hence educating them in whatever medium you can, I feel that would bridge the gap. So what Dr. Dipti and you spoke about is the part of reaching out, okay, creating facilities, being there, but increasing their readiness or their awareness to understand mental health, engage in mental health practices, accept this also as a part. As Dr. Dipti said, I very well agree. They might have their own mediums of addressing mental health issues, like the religious ways, spiritual gurus. It may even go to superstitious type of
Right.
practices, right? And it is very rampant across many parts of our country, right? A lot of self harm also is,
Yeah.
instilled as a result of this. Now, even though we encourage them to continue with such practice, also one challenge becomes is, what if a superstitious belief causes harm to them? Okay, do we just accept it and we tell them to continue with it? That becomes a challenge, and that becomes a very sensitive talking point, I think, in therapy, where we need to discuss that this is harmful to you. Are you aware of it? Okay,
Right. Right.
and are you
Yeah.
making this choice by being aware of this? So I think this process of engaging with this type of ideas before we engage well deeper into the idea of therapy, I think is very important. It's a precursor to uh,
And I think that kind of resonates with what one of our participants, Pushkala, has also put in, that it's important that we kind of, not only spread awareness, but also awareness of what to expect in the counseling
yes,
sessions.
yes,
What are the
absolutely,
things, right?
absolutely.
So I think that's great. And there's one question, Dipti, I don't know if you can start off with it. Very nice question. It says that, can you, Geeta Venkatramu has asked, can you please explain about, what are the positive effects, right, that culture brings, maybe into therapy on children and adults, or brings into mental health management? So, if
Yeah, I think that's an excellent question. Something which I wanted to speak about
right,
because it's been documented. Research has shown for many years that in the Eastern countries we have seen less of mental health issues as compared to the Western countries. And one of
okay,
the reasons is the cultural perspective we have, the family dynamics that we have, and the support system that we get from the community,
right,
which has been a huge positive impact. Now, of course, with the rapid urbanization, things are changing, dynamics are changing, and the statistics, unfortunately, are going bad rather than good. Because now we are more into nuclear families, less community
right,
support in terms of whatever we used to have as a religious community or
right,
that kind
right,
of thing. So, but yes, culture has a huge positive impact. It gives us a lot of boundaries. It helps us take a lot of decisions where we might sometimes be confused. Many a times, if like even if I'm talking about children, if there are certain norms which are in the family, which may be religious norms, social norms, they help in inculcating values in children.
right,
So that is very very important. So like if your religion says, like say Jainism says a few things, Hinduism says a few things, whether the Christian religion says something, and people tend to follow that, and that is very easy to then inculcate those values in children. These
right,
things give us a lot of values, a lot of boundaries, which help us understand ourselves better as individuals. So a huge positive impact of cultural perspectives overall, as what we say as building resilience within individuals. So I think
right.
that has always been there, especially in the Eastern cultures. We have always experienced that, and here it is still like that. That if somebody has a major mental illness and is not able to earn, the other siblings will pitch in. They will take
Right.
care of the kids of that.
It's kind of expected that that will happen.
Yes, absolutely. It's not like an obligation, but
Right.
that is, the general just rule, that it will be done.
It will get
So
taken care of. Yeah.
yeah. So I think that helps a lot in relieving the stress. Otherwise, you have one person with a major mental illness, and the spouse and kids then going through mental illness issues just because
Right.
of the mental illness of that person. Whereas if that is taken care of, we have lesser people to look after in terms of their mental health issues. So I think those huge good positive
Right. Great.
impact the cultural perspectives.
Right. 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 Wilbur, any thoughts on this?
Yeah, I think I would extend to what Dr. Dipti said, and I agree totally with what she has contributed to this question. Is one factor with at least our culture, which gets in because we come from a very collectivistic type of culture, is the support mechanisms are there. We because in the Western countries, this whole idea of support groups. Okay,
Right.
it's very rampant. The idea
Right.
of the notion of support groups is required because people need to go and seek out for support, right?
Right.
But for
Right.
us, within the idea of joint families, within the idea of community, neighbors, reaching out to each other, okay, within family support systems, this idea of support systems are already there. So and hence this idea of support group. Okay, I know there are very different dynamics to support groups. I'm not trying to, somewhere undermine the importance
Absolutely.
of
Yeah.
support
Yeah.
groups.
Yeah.
But what I'm trying to say is, through our culture, we have this natural idea of support. Like, for example, even the idea of altruism, okay, reaching out, helping people is so, in the Western research, you see, or, altruism is looked at as a benevolent act, right? But for us, it is a given.
It is a natural
Okay.
thing.
It's a
Right.
natural
Right.
thing. If
Right.
someone needs help, if you do not help them, you are looked down upon,
Yes.
right?
Yes.
So
Yes.
it's
So
something
that's
what
again a part of the value system, right?
value system, right? And
Right. Right.
so I think this is something which acts as a good protective factor. Okay, so there
Right.
are definitely cultural stresses, which, but I think there are also protective factors which helps us deal with a lot of, and probably that's one reason. I don't know, like probably you all both would also throw light on it. One reason I feel many people do not go to seek mental health services till they feel that it is something which they
That
cannot handle,
cannot be
or yeah,
managed within the
manage.
family
Yeah,
or
right.
extended
So
family.
yeah.
Right.
So, and I'm not talking about the disorders or the extreme
Yeah. Yeah.
conditions.
Yeah.
I'm talking about even general
The daily
adjustments,
life adjustments,
issues,
issues. Yeah. Yeah.
some general distress they are facing. I
Right.
think they would not seek for help till they feel it's not manageable.
Right.
So they already have a primary so-called mental health system within the community what is there, and I think that's the beauty of what our culture gets into this type of
You know that
this.
just now when both of you were speaking about community support, and how we don't have to really reach out somewhere else, externally for support, immediately brings to my mind what happened 2 3 days ago in my paternal family, where an old aunt who lives alone in one part of the house, when she had a fall, I mean, it was night, around 9 o'clock at night or whatever, but it's like, everyone from the house rushed there. They gave me a call. I went there. We ensured that, we could get the doctor in. I mean, at least the doctor's opinion, what had to be done. We saw to it that, the meal was done, everything without really having to move away from the
Right.
people who are a part of it. And an old person just got taken care of. And it was interesting how then, 4 or 5 of us were just standing there and chatting and talking. And then, my husband even ordered ice cream for everyone. And then it kind of turned into a little social kind of an event for just about half an
Yes.
hour, and kind of lightened up the whole thing. So I think, yeah, that's I think a very good this thing about the positive impacts that it has. Bhagyashri has a nice question, Dipti, and I mean, I'm just going to read it out. That Dipti ma'am spoke about how clients report somatic symptoms first. So how can we further question them and get a client to talk about the emotional affliction? So what she's saying is, how do we cross over, right, from the somatic to the emotional, and are there any specific questions we can ask? I know that this is a process, Dipti, but I mean, obviously what they're saying is, with your experience, can you give them 2 3 gems that can help them do that?
Yeah, so one at the first session itself, one thing that I ask very much is about their sleep, because it is a somatic symptom, but it also has a huge psychological impact. And a lot of our patients, along with the somatic complaints, will come with sleep complaints. So when they
Okay.
say that they are not able to sleep well, and then I
Hmm.
ask them, okay, what are the thoughts that run in your mind when you're not able to sleep? And then
Right.
from there, we try and pick up cues and
Oh,
get
wonderful.
them to talk about their thoughts and emotions and moods. We also try and understand the family dynamics. So we understand, okay, suppose your kid is not behaving according to the way you want the child to behave. How would you react? Would you just keep quiet? Would you get angry? Would you get upset? What is the thought that runs in your mind at that time? So these are the types of questions that we try to ask. Of course, it depends on the openness of the patient. We know, I mean, we have to judge what we can ask, what we cannot ask, in which session we ask. The first session, many a times, we have to tell them, yes, whatever I have given you medicines is for the somatic symptom itself. I have to
Right.
say कि इससे पेट का दर्द कम होगा या इससे आपका सर दर्द कम होगा. I cannot say
Right.
that, this medicine is for your emotional issues. So
Right.
once once we start with the medication, I mean, I'm talking about medication because that's what I see normally.
Of course. Of
So
course.
once they've taken medication for 10-15 days and they feel the relief, and then the trust builds up that okay, this doctor understands my problem and is able to give me relief, and that's when I can then go deeper, ask more questions. But we try to use these kinds of examples, ask them daily routine situations, that how do you react in this situation, how do you do in this situation, what is your friend circle like, how often do you meet them, and all that. So that's how we start, and then we get cues from there, and then we go further into it. So sleep, appetite, these are a few somatic symptoms that we take on and then go on ahead to get into the emotional aspects.
Okay. So I'm just looking at it slightly different, maybe a larger social issue. And, any of you can comment on it, but Wilbur, if I can start off with getting
Yeah.
your thoughts on it, is that, what in your experience and, general knowledge, how does poverty, right? How does poverty impact mental health? I mean, where and how do those two major issues kind of interact?
Uh, there are two ways of looking. I think I would address this question in two ways, and there are two perspectives, even with a lot of literature says. First of all, a lot of reports on depression speak about poverty as being one of the major causes of depression, in especially developing countries. Okay,
Right.
that is one report. But there are also studies which have tried to indicate that many a times coming from adverse backgrounds or deprivation, facing chronic stresses as a result of the type of life situation you have to deal with on a day-to-day basis, makes you more resilient or ready to cope up with adversities better.
Okay.
So there is a side which says that okay, you develop mechanisms, you develop coping mechanisms because that's something you are dealing with on a day-to-day basis. So
Right.
something, someone who would feel very vulnerable or very distressed with a small crisis. Okay, for a person who has experienced poverty, who has come with a lot of challenges in life, would be better able to deal with it.
Right.
However, we cannot neglect the type of impact it has. Okay, the type of impact, the type of social experiences which come from poverty, because many people look at poverty from the idea of economical insufficiency
Right.
point of view.
Right.
But
Right.
however, with the idea of economical insufficiency, there comes social status. Okay,
Yes.
there comes feelings of insecurity about the future. Okay, I'm reminded of Martin Seligman's idea of learned helplessness. Okay, helplessness is
Yes.
a type, okay, that I cannot do anything about my situation, right? So all these things are precursors to what we understand of a lot of mental health issues. I think this is something what we need to understand. Okay, so experiences of humiliation, like for example a child goes to school. Okay, like I have had, earlier when we used to go to schools because of the department, I do not deal with work with children anymore, but
Right.
I remember children telling that how they avoided telling in the class, when other students ask what is your father doing working. So father who's a child whose father was probably working in the municipality, you know doing some
The
jobs, okay, which are,
sleeper, whatever.
yeah,
Yeah.
sweeper, okay, which is
Yeah.
not considered as socially dignified, or there are
Right.
certain notions of looking down upon this type of, so they would avoid telling this. Okay, so there is a type of internalized humiliation with their identity, with their life experiences, or they would
Right.
not call a friend to their home
Yeah.
because they lived in an overcrowded small space, probably not aesthetically as good as their friend. So these type of experiences, okay, which remind you of that probably your life situation is not as good, or you are experiencing this type of deprivation or humiliation on a day to day basis. Okay, this is something which also causes a lot of, I think can make you very vulnerable to different types of mental health issues. And I think we need to look at it, this idea of poverty, we need to look at it as I said earlier, beyond this idea of just economic insufficiency, right?
Right,
As
right,
typically how economists would look at it, right?
right,
So
right.
yeah,
And also because, I mean, look at it this way, I mean, that it adds on to the risk factors, right?
absolutely.
Yeah, I mean, you can have some negative impacts of culture, poverty, gender. I mean, there are all these risk factors which are kind of adding on to it. And I think that, I mean, when I'm saying about these risk factors, I'm just saying that these are, I think, very important components that we must be aware of and we must explore, talk about it with the client, the patient, so that they are aware that they are going to be battling these obstacles, I think, and see them as risk factors. I mean, this is just, my opinion. So, Dr. Deepti, do you recall any individual case, okay, where you found that maybe, when they came to you, they didn't have certain resources, and maybe, you were able to either intervene or mobilize these resources, and that helped you turn around this particular case? Anything like that?
Um, so I can think of this one lady. She had, by the time she came to me, she had been married for about 12, 13 years. But she had a bipolar mood disorder. And because of her manic symptoms,
Hmm.
the husband and the husband's family could not handle those symptoms, understand that it is an illness. They were not open to taking her for mental health help. They thought she was doing natak, as is always said,
Right,
that
right,
she's
right.
pretending. And she was abandoned. She was sent back to her parents' place, and she was staying with her parents for almost 3 years before they came to me. Um,
Okay,
and then she was brought to me. We started treatment for her. In about 3 to 4 months' time, most of her symptoms had resolved. Few remained,
okay,
but quite a large improvement.
right,
Luckily, we were able to get her into a part-time job also.
right.
After her symptoms had resolved. And that's when I started this idea of trying to get in touch with the husband's family, because
Okay,
the parents were old and they were very worried that, what happens when we are not there, if who's going to look after her, and they
right,
wanted her back with the husband's family. So
right,
luckily the child had by then, kind of, I think, yeah, probably the child was around 16, 17 years old. Son, she had a son.
right,
So maybe I'm wrong on the number of years of marriage,
right,
but
right, right,
yeah, so 16, 17 years old son, and luckily I could get through to him. The nanny managed to bring him, and I spoke to him, made him understand, and then he started interacting with the patient on telephone without the knowledge of the father for a couple of months. And then he spoke to the father saying that, I've been talking, mama is much better, let's go and meet the doctor once. And
right.
then that's how the father came in, of the son, I mean the patient's husband. And
Hmm.
then we were able to make them understand what is an illness and how it is, and explain to them, got them out of the negative cultural perspectives which were keeping them away from treatment. And
Sure.
then I arranged for a meeting between the patient and the husband in my clinic. That was the
Right,
first time they met after about 5 years.
right,
So that's how, and then he could see the change in her behavior and everything. And
right,
that's how then eventually they reconciled, and now she's staying with her husband and son and mother-in-law. And everything is fine for the last 2 years in terms of, their family dynamics. So I think if we are, aware of the cultural perspectives, and if we
yes,
are aware of the family dynamics, and we take that one extra step, I mean, rather than
yes,
saying that, my duty is just to make sure that the patient is
yeah,
symptom free, if I
right,
take that one extra step of trying to rehabilitate the patient in whichever way, whether it is into the family, whether it is career wise, whichever way. So I think the goal for us should not be just ending at the treatment part of it, but at the rehabilitation part of it. Then I think that that will go a long way in helping our patients and clients.
right. So I think what you did was extended your role into community support, if I can put it that way,
Yeah,
right? Yeah.
yeah.
I would request all participants to please fill in the feedback form link that has been put into the chat, and I will. ask Dr. Wilbur to end this webinar with any such experience of his where you might have, like Dr. Dipti said, managed to turn around anything in terms of, mobilizing some resource or whatever.
I would like to share one interesting case because we
Hmm.
are talking about culture today. Okay,
Hmm.
and there was this very interesting case, and which also explains how cultural notions impact a lot on how we perceive situations and how it impacts us. I Because in our country at least, okay, it's more than universal, but in our country, parents are viewed in very high regard. Okay, there's a lot of respect, honor. Okay,
Right.
there are notions like that they are second to God type of an idea. Okay, so holier than thou type of an idea associated with parents and parenthood. Okay, so they are supposed to be good role models and all that stuff. There was this one case who was recommended by an HR of a company to me, and because the case was because she was facing a lot, she was not able to concentrate on work, her motivation was low, and all those factors, which were performance related factors. Actually, I will not go deep into that. And in the initial sessions, I started revolving around her work, her colleagues, whether she had lost motivation and typical work related issues. But I think what I noticed was she did not have any explanation of why her motivation was going down. And she, all what she said, everything was good. Her colleagues were good. She was enjoying her job, but she could not give a good. So it was one session, two sessions. Then somehow she tried to project those experiences onto her boyfriend, okay, who she was dating that time, and she started saying that she had problems in the relationship. So I started exploring those aspects, and when I was exploring those aspects, everything seemed to be fine in the relationship too. And she herself started acknowledging that I do not know what is wrong in the relationship.
Right.
And then suddenly, when because she used to stay away, she was from a different state, and her parents were living in a different state. So she started to happen once to tell me about how her parents used to call her up, and to tell her to get married fast. And
Huh.
that's how I realized that she used to speak only about her mother, but never about her father.
Okay.
So I realized that this information was withheld, and I was surprised that for good 6, 7 sessions, she never spoke about this, never came into the open about this. And she happened to, when I tried to, probe further about her father, okay, after some time she came out and she actually started crying. She, showed even, in fact, nauseating, type of feelings, when you experience a sense of disgust,
Right.
okay, that her father had an affair with her mother's friend,
Right.
and there was so much of experience of disgust, distress associated with that, because this whole idea of morality associated with parents,
Right.
and to
Right.
have a
Right.
parental figure do something like that, and her father had told her to not tell the mother about it, because she discovered about it, but not to reveal it to the mother. So she had to be probably going to that guilt of not being able to be a good daughter to her mother by revealing
Right.
it, at the same time dealing with this whole idea that how can her father do something like this,
Right.
so
Right.
this whole idea of morality, or hyper morality associated with parents. So what I had to do with her is actually make her disassociate the act of a father as an act of a father, but then act as of any human being, okay, who had done it. Okay, so
Right.
what I tried to work through with her was to make her understand that that deed, what her father did, was as an individual and not as a father. The moment she
So
looks
the
at it,
role separation, so to say.
yes, absolutely. The
Right.
moment she looks at it, that problem from the point of view of that the father did it, it would be even more distressful.
Yes.
It can be unacceptable, but the amount of distress she was experiencing because the notion of the father associated to the to the person who did this act, okay, so I think with that she was able to experience some type of relief, and this and she reported some improvement over time. So I think this is a very good example of how cultural notions, which are
Yes.
embedded
Yes.
within us, can also contribute to a lot of our distress. So
Right.
this is, I
Right.
thought, would be an apt case to share for today.
Very interesting. Very interesting. So I think with these two very interesting kind of cases that you have very kindly shared with us, I think I will close the webinar for today. Thank you, Dr. Dipti. Thank you, Dr. Wilbur. It was such a pleasure. And I think from the comments also from our participants, I think they found it very interesting. I think otherwise a topic which, usually, like Wilbur said, not taken up for discourse, can tend to get quite boring, when I think was a very interesting way of looking at it, and which is what I'd hoped for, bringing in both the medical and just a psychological point of view, right? So thank you, Wilbur and Dipti, and look forward to having you again on one of our webinars. And thank
Sure.
you, participants. We do hope that you've enjoyed the evening and gone back. I think there were some excellent nuggets to kind of internalize and take forward, whether you are an academician or a student or a practicing counselor. So, a very good evening to everyone and have a wonderful week ahead. Bye bye.
Thank you.
Thank you,
Thank you
everyone.
so much, Dr. Smita. It's always a pleasure. And I think I really commend you for the way you have conducted webinars through the pandemic. I think it requires a lot of effort and enthusiasm, and you are definitely an inspiration.
Thank you, Dr. Dipti. But it's so much of teamwork. It's an
Yes.
excellent teamwork, and the team really works very, very hard
True.
at at getting people together, right from conceptualization of the topic, what's the trending need, what is it that as a team we want to psychoeducate about, and there's been so much of upheaval because of this pandemic, right? In fact, there's a very interesting topic that Dr. Avinash today kind of himself initiated and told me. I mean, Dr. Avinash is right now the president of the Bombay Psychiatric Society, right? And he said, Smita, we really need to. I mean, he never calls me Smita, he always calls me Dr. Smita. But, he said there's really a need to begin a lot of conversations about back to school,
Right.
Yes.
Very
and that's really something I'm planning to probably take up as the very first webinar of 2022, right? So hope to have you all on board in those ensuing conversations, right? And whoever, as many participants as we get, I think, if we can make a difference in a small way, in a big way, I think that building blocks are then done.
In
right.
fact, I'm reminded, Dr. Smita, that you spoke about that you started this idea of Wednesday webinars. So I was reminded of Sigmund Freud, who started his theory building with something called Wednesday circles. So there was
Interesting.
there was a congruence between Wednesday webinars and Wednesday, and Carl Jung, Otto Rank, all these neo-Freudians who we know later, were actually part of this Wednesday circles. They used to sit together, they used to critique his
Oh,
theory,
wow.
come up with different perspectives. So I think
Right,
that's
right.
a tradition you are trying to create. So it's very
but
interesting.
but but I cannot take credit for the Wednesday
Yeah,
because because it's the team. It's also
right.
Anand, who is my partner, both at marriage and at Drishti, Miss Madhura, who is our head of operations, and there's an entire team which handles these webinars and which handled it at the conceptualization. So I'm certainly going to share it with them. Thanks so much, Wilbur. It would be a very
Yeah.
interesting fact, probably also for us to put into some of our social media when we put up the webinars, right? So we will look further into these Wednesday circles. And thanks so much for
Yeah.
sharing.
Thank you for
Yeah.
listening. Thank
All
you.
of you have a wonderful evening ahead.
Thank you. Bye.
Okay. Bye bye. Bye
Bye. Bye.
bye.